I'm Marc McCollaum. I'm a physician assistant with master's degree, and I've been practicing for about 30 years. Yeah, we practice regenerative medicine, and we really are taking a look at the complete individual. Sometimes there's a need for a gentle approach. Sometimes you need surgery, but you don't always need a sledgehammer for every job. One of the first tenets in medicine is, of course, back into the old Hippocratic oath of first do no harm. And we do try to, use therapies that are natural, gentle, and again, the right tool for the right job. And we always try to look for what's going to be for the best fit for the patient. And every patient is treated as an individual. They're not cookie cutter. We don't have one thing and everybody gets the exact same thing. Everybody gets very individualized attention, everything from their diagnostics to their individual treatment plan. Everybody's going to have a little bit of a different result. Again, these regenerative proteins and the cytokines are going to go all over the body. We have no control of where they're going. We can place them into a joint to get a little bit more of a boost, but they are eventually going to migrate into every tissue in the body. The body, when it's in pain or it has a problem, it sends out like a chemical smoke signal per se saying, hey, I need some help here. And that is a signaling chemical that is now going to attract those proteins and cytokines to go to that particular area. You may not even know that you had a problem, but it's now going to be going in there to try to fix and address those issues. If you have an area that hurts, those pain signals that you feel the pain, that's actually your body sending out a signal that says, hey, send something over here, we need some reinforcement. That's usually the first thing that we notice that starts to get better is the acute pain improves. The mood changes, you start feeling more energy. Sometimes they even tell me, I'm actually feeling better, my joint is feeling better when they walk out of here. I had one gentleman that we did some paraspinal injections and he was slumped over and he was actually walking tall within 30 minutes of his injections. And yeah, we've seen it work that fast, but it continues to work even initially, or even after the initial injection. That honeymoon period starts to fade out a little bit, but these things continue to work in the body for weeks and months afterwards. So we've just begun. On the business side, my wife wishes I was home a little bit more. We are completely booked out for the next 3 weeks. New consultations. We don't really do any advertising. Our advertising is done by word of mouth, and everybody is telling their friends, their family members. We're getting calls in. Do you treat this? Can you treat this? Do you have any experience with this? I'd like to come talk to you about, my problem. And I've had more new patients probably in the last 4 weeks. Again, I'm booked out for the next 3 weeks, pretty much solid. As far as satisfaction, I'm tired, but I feel very satisfied. It's very rare that we ever find something that literally has the potential of, I know we're probably not supposed to say this, but treating to the point where the condition is almost non-existent. I don't want to say the cure word, it's kind of a buzzword, but I can definitely see that this is where the future of medicine is going, and I'm very optimistic.